Oh, hello guys, welcome, long time no see, welcome back to a vlog. Oh, it's been a minute. I am now back at work. So I have finished my maternity leave and I am back at work. Oh, it's crazy. I've been back at work for sorry guys, hopefully this is an okay angle. I can't really speak too long in the car because I'm just driving to work, but I just wanted to let you guys know that I am back at work. I started last week, so I've been at work a week, but last week was a training week, so I just did like refreshers and online, just all my online stuff, and then I just sort of buddied with someone who I used to work with, and yeah, just buddied with her, and then just did a refresher sort of thing to help with just to get back in the swing of things, I guess. So I'm no longer doing after hours. Yes.
Just sort of have a gym lag while you're on your way to work.
I am. Hey guys, sorry about that, but my husband just called me because he finishes work. He does night shifts, so I just wanted to catch up and have a chat. So anyway, I've just got to work. I've got to hurry up because I'm gonna be late. But normally, yeah, so I am now in the relief pool. I'm no longer doing after hours because they cancelled that shift, but because I'm permanent to the hospital, not to the ward that I was in, the orthopedic ward I was in. So yeah, so now I'm a reliever. I have permanent part-time position, but I'm a reliever, and what happens is my manager sends me a text message on where I need to go, like this morning, or I just go to her and up to her office, and she'll tell me where she wants me to go or whatever. So yeah, this morning she sent me a text message, and I'm going to the orthopedic ward. So that's where I'm going, and I'll try and fill you in later. Okay, bye. Hey guys, so I'm sorry I didn't really get to film much today. Like it was really difficult to like pick up the camera, obviously, or like, well, I wasn't going to pick up my camera, but I was like maybe going to use my phone to vlog because that's a bit more discreet. But obviously it's really difficult because you don't want to be disrespectful to people, and you don't in your workplace, and you don't want to be, obviously you're not willing to cross that line. I know I'm not willing to cross that line to like obviously show patients or patient information, because that's a big no-no. That's like a massive no-no, obviously, because that's patient confidentiality, and you know, with or without a vlog, you know, you can't do that anyway. When you're administration officer in a hospital, you have to be very careful. Even when patients ring you on the phone and they want to know about family members, you have to be very careful in what information you provide, if they're not like, especially if they're not like next to kin sort of thing. So anyway, it's just very difficult to really show you what I was doing today, which was kind of a shame because I actually had a really good day. And like I said this morning, I was in the oncology clinic. So I was in 5G oncology, and it's really interesting because I found that this clinic, it's like an outpatient department, but then it's also a ward. So you're like, there's just so many different moving parts to this area, this section of the hospital. It's just really like you just do one thing and then you're like doing another thing, and then you just like, yeah, it's just constantly so many moving parts towards like in the job, if that makes sense. Like once you do it over and over and over, you get used to it and whatever, but you know, it's just, yeah, it's very busy. And like apparently Wednesdays are the busiest in the clinic. So today they had the morning clinic and then the afternoon clinic. So what will happen is the patients come to you at the front desk, and then they give you their books, they give you their little like book that they have, and then you check them in, and then when they go home they check you, that you check them out, and then you have to like get them to sign because it's Medicare, but it's not like public, it's private, but it's bulk billed. So they have to sign it, and then we have to like put it in the slip with the patient's bloods that the nurse gives you, and you have to put it in like a clear envelope, like a clear plastic sleeve, and you have to put it in the doctor's you know, and then you have to put it in like the doctor's section, so the doctor can come out and grab it and then bring in the patient, and they have the information there, and all that sort of thing. And you have to, when you check the patient in, you have to ask them to, because there's a scale, and they have to weigh themselves every time they come to the clinic, and you have to do that and write that on there. And then it's just so many different things to remember. And so like I feel like you're just going from one thing to another, and you're just like constantly jumping. And that's why I feel like I just said like 50 million times, it's so many you know, there's so many like moving parts to this area that you're in. And there's 2 AOs, and one sits over here, and then the other one sits over here, and I was over here, so I was the one that was doing all the check-ins and the check-outs, and just all the stuff with the doctors. And then the person here would answer the phones and do the rescheduling and all that sort of stuff. So it is like quite busy. But yeah, obviously I haven't worked there since, I only did like 2 or 3 days tops before I actually went on maternity leave. And then I came back from maternity leave, and I was like, oh my god, what the hell am I doing? But at the same time, I also kind of feel like I was able to jump into it quicker. Like I forgot what I was doing, but then when the other AO helped guide me along, I sort of feel like with certain things I was able to like pick it up quicker, if that makes sense. So yeah, so it was really interesting, you know. And then so like, yeah, so they would come to, yeah, so it was really interesting. And that outpatient aspect, and they would come and you check them in and all that kind of thing. But then if they just had the appointment with the doctor, you would just check them out when they left, or if they just had medication or whatever. But then if they were to go and have their chemo treatment, which they would then go into a sort of a separate waiting area, and then they'd go out the back, and there'd be like chairs and beds and stuff for them, and they'd have all that they'd have their cancer, they'd have their chemo treatments and stuff that they need to have, and then you would then have to check them out of the appointment, and then you'd have to admit them, and then you'd have to discharge them once they basically went home. So it was like you were jumping from outpatient to wards, because you were like doing different things. Like in the wards, you're admitting, you're discharging, all that kind of stuff. And then in outpatients, you're like checking patients in, checking them out, making appointments, all that sort of stuff. So it was a very interesting dynamic. But yeah, I really loved it. The day went really quick. So I don't know where I am tomorrow, and like, it's hard because I do miss orthopedic ward and I do miss working the after hours, because I really built up such a rapport with the nurses, and I knew the work. But at the same time, there was some really good parts about that, but at the same time I did get bored quite easily because I did know all the work, and it was just like the same thing over and over. It might be like you had obviously new patients sometimes would be the same ones, depending on how long they stayed in the ward for, but I feel like the work is pretty much the same, obviously. And yeah, but I feel like with the relief pool, you're just going from one place to another, and sometimes you might be in the same place for a week, or especially like the full-timers. The other AO I was with today, she is a reliever as well, and she's covering the oncology clinic 5G for about 2 weeks. So she's in their same spot for 2 weeks, whereas me, I'm not full-time and I'm only part-time, so they're not going to necessarily put me in the oncology clinic for all my 5 days a fortnight, if that makes sense, because they'd probably rather someone that could do that full-time, so they don't have to keep swapping and changing, I guess. But it was good that I was learning that, because I feel like being there has taught me more than just being in a ward or just being in an outpatient department. I just feel like I learned so much, because I was like jumping back and forth, and I was just like, I had to do this, and then I was like ready to discharge a patient or discharge, and the patients wouldn't come to you to discharge, but you'd have like get handed from the nurses or the doctors or whatever, and then hand you the paperwork, and you'd like be ready to do that, and then a patient would come up to the desk and be ready to check in. So you'd have to like put the admission or the discharge paperwork aside, and then you have to do the check-in, and then you were just like jumping from one to the next, and then you like had to then walk around the back and put in your give the pharmacist the admission paperwork, so the pharmacist could check all the like medications and the weight and all that sort of stuff, And yeah, so it's just like, yeah, it was really interesting, and will be so happy when they put me back there, honestly. Like, I really loved it. I loved like that challenge, and I loved, like, my brain was just like, wow, like, so yeah, it was just like overworked. It was like so worked. Like, when I finished work today, I was just like so mentally drained, like mentally tired. It was like next level, because I'm not used to it. Like, you know, I've been at home for the last, you know, a little while I've been on maternity leave, and as much as like I love being at home with my baby, it's not mentally stimulating, as in it's the same capacity as you going to work and you, like, you know, being a health administration officer. Like, it's just so, I'm sure for a lot of jobs as well, like the mental capacity that you need for your job can be quite high. Like, yeah, so I'm pretty knackered, I'm pretty tired. But yeah, it was really interesting, and I have no idea where I am tomorrow, like I said. So my manager will probably just send me a text message tomorrow saying, go there, like she did this morning. She just sent me a text message, which is good, because I didn't have to go up to the office and go, hey, where do you want me? She just sent me a message, which was good. So yeah, so I'm going to film tomorrow as well. And I don't know how much footage I've really gotten today. I don't think I've gotten a lot. So if I haven't gotten too much footage from today, then I'll just continue on tomorrow, and it probably will be kind of like a long-ish vlog, but you'll be able to see, hopefully I'll be able to like sneakily film sort of what I'm doing depending where I am, and I'll just be very careful in what I show you. But I think it's really interesting, and if I was wanting to be an administration officer, I'd kind of love to see like the ins and outs of it, or behind the scenes of it kind of thing. So yeah, so anyway, I am absolutely tired, so knackered, and I think I need to have an early night tonight. I haven't even gotten dressed out of my work clothes. I've still got makeup on. My hair's a mess, but anyway, but 2 out of 3 kids are in bed, so I've got 1 more kid to go to bed, and he's going to be going to bed soon. So yeah, so but anyway, if I don't have much, like I said, if I don't have much footage from this vlog, I'll just continue on this vlog, this work vlog, tomorrow. But if I do, then I'll just end it. So anyway, I'm going to finish off the vlog now, and I'm going to try my best to get these kinds of vlogs out more for you guys, because I know that you guys really enjoy them, and I know that, you know, I do get a lot of questions about just everything about administration officers within health. And if you don't know, I do live in Australia, so my experiences and my circumstances are obviously from an Australian perspective, but I mean, I'm really passionate about being a health administration officer, and I do really love it. And I think it's a really good job for you to do if you don't want to be a nurse, or you don't want to be a doctor. And I'm really passionate about providing customer service and I really love working with people. And one reason why I really like being an administration officer within health is because I feel like I can make a difference without being a nurse or a doctor. And that says something. Like, I don't have to go to university to feel like I'm making a difference and helping within health, and I get to work in the environment that I really enjoy working in. So yeah, I feel really feel blessed that I have this position, and I've worked hard to get to where I am now. It's taken me a long time to be permanent too, but I feel like I finally found a position that I'm really happy in, and then I see myself staying in for long term, because I have worked in so many different departments. I've worked in mental health, I've worked in emergency, yeah, so I've done a few different things within health, and I've worked in this industry, or I have worked in this career, I guess, for the last 7 years. So yeah, anyway, enough blabbering. But if you like this kind of content, then please, I'd love if you could subscribe if you want to. And if you feel like you liked this video or you got any valuable information, then please hit the like button. It really helps my channel. And yeah, so if there's anything that you would like to see, or any videos that you'd like specifically for me to make, then please just put it down in the comment section down below. And I'm happy to help you guys. I really am, because I know that I might not be as much help to you if you live in another country, but I will do whatever I can to help you guys, because I think that this is a really good job, and I'm just really want to help you guys. So if you have any questions, then please don't hesitate to ask them, and I'll be happy to help you guys wherever I can. Anyway, thanks for watching, guys, and I will see you in my next health administration vlog. Thanks, guys. Bye.